Good morning, everybody. I definitely know the pressure is on because I'm the last thing between you and either the sun, the gambling, maybe your plane trip home, etc. So I really appreciate you all sticking around for one last presentation. Pressure's on to make it interesting, I know. I think we're in good shape. I think we've got a lot of pretty cool programs to talk about. And kind of preparing for today, I asked Tom, what would you like us to focus on? You know, probably quite a few people in the room are pretty familiar with American Health Holding. There's probably, some of you who haven't heard of us, and some of you are somewhere, in between, and certainly some clients too. So we appreciate that. But as you can imagine, Cypress is a very innovative company. They're always looking for what's next, and they push a company like us to be better. And so we love customers like that. We also have the same mentality, especially under the leadership of Paul and our senior management team. We're always looking for ways that we can make your members healthier, save money, be more integrated within our programs and within the TPA programs. So anyway, I'm gonna go pretty quickly today because we're kind of cramming, I guess, for the final here. I've got about 6 products that I'm gonna try and run through and at least at a high level get you familiar with these products and services. So the very first one is our 24/7 physician consultation program. And this is a program, I always liken it to a nurse line on steroids. So similar to a nurse line, a member can call 24/7 and have access to a US-based physician and be able to get their questions answered regarding their health or medical issues that they might be having. The really cool part about the program is rather than then going into the doctor because they do have an illness and having to pay out of their pocket to be able to have an office visit, or maybe they procrastinate like many of us and they have to go to the emergency room. Instead of doing that, they can stay in the comfort of their home or on their lunch break, go ahead and call a doctor and share what their symptoms are and be able to get diagnosed and even get a prescription written over the telephone without ever having to leave their home or having to leave work and go in and incur an office visit. So as you can imagine, it's very convenient. Members tend to get treatment a lot quicker, and they don't have to tap into their deductible or a copay to be able to get that treatment. Also obviously helps the plan in terms of their overall costs. We've partnered with a company called Consultation for this service. We have looked at other companies. Somebody mentioned Teladoc the other day. There's other competitors out there as well. We really feel like Consultation is the best. They offer the whole spectrum of ways that they can work with a member, whether it be through the telephone, through the web portal, or even video conferencing. So we like that about them. We also really like the pricing structure that they have. It's a fully capitated model, so an employer can budget for it, and the return on investment is really, really good as a result of it, because typically the employer is sponsoring the benefit. So the member has nothing to lose and everything to gain by making a phone call first when they're sick, rather than just running into an office visit. So the return on investment is generally at least a 2-to-1. We have clients that are 5-to-1 and much higher. So really good bang for your buck with this product. As I mentioned, there's a couple ways that members can access the program. They can go ahead and make a phone call. They can call in and be immediately connected to a doctor and ask questions. If they are sick, we need to match them up with a doctor that's licensed to prescribe in their state. So they can either have a doctor call back as soon as one's available, average is about 30 minutes, or they can make an appointment Monday through Friday to have a doctor call them. The doctor, again, will review what their symptoms are, make treatment recommendations, and if appropriate, they'll prescribe a medication. The vast majority of the medications are antibiotics, some steroidal medications, so you don't have to worry that there's any painkillers or any of those types of medications that are being prescribed. They can also do a video chat. So many of us now have an iPhone with a little camera on it, or we have Skype set up on our laptops. They now are able to work with members through the video chat. And that's really helpful, obviously, to be able to see that member and have a better idea of what their symptoms are and how they're feeling. And then lastly, there's a set of web tools that are available with this product. And a member can send a secure message to their physician and get a response back. Sometimes it's questions that maybe they're not all that comfortable talking to someone about, but they're comfortable sending an email. So it's just one more way that they can access a physician. In terms of the types of conditions that are treated, this definitely isn't for every illness. They can't do biometric testing, they're not doing x-rays. So it's really for your more common conditions, the colds and flus, bronchitis, sinus infections, those sorts of conditions. And oftentimes members are chronically getting those situations, and they know what they're going to need. They're going to need an antibiotic to knock it out, maybe some amoxicillin, but they have to still take time off from work, go in and see a doctor just to get the script they knew they needed. So it's much more convenient, and they get treated much faster and much, much less expensive. I do like to point out the stat that I've got in the blue box. It was a study done by the Wellness Councils of America that said 70% of all in-office visits could have been handled by a phone call. So I think that's pretty compelling. Again, these are all US-based physicians. We have physicians in all 50 states, so able to handle any of your members. Even if a member travels outside of the country, they can still call, consult a doctor, and utilize this product to get information and get some guidance. I'm in Thailand, and I have these symptoms. Do you think I need an antibiotic? What do I need? And just be able to have that guidance, I think, is really valuable as well. Also, if you're on vacation, you forget your meds at home. Sometimes it's really hard to get a hold of your doctor and get that script written. Instead, you can call, consult a doctor, and they actually have access to a database of medications written over the last 2 years. They can tap into that and get you on your way and get a script called into the nearest pharmacy. So lots and lots of benefits. I want to point out the utilization. The utilization for our book of business in 2011 was 19%. Again, I mentioned earlier, I liken this to a nurse line in some ways, and a lot of clients tend to think of it that way. Typical nurse line utilization is about 2%. Other telemedicine companies that I've looked at tend to be around 2%. So we're really proud of the fact that our utilization is so high. It's the type of program where you want to keep reminding members that they have it and that it's available to them. But once they're sick and they utilize the product, they tend to be kind of a champion for the product, really, and they continue to utilize it. And therefore, the utilization keeps driving up. And lastly, I just want to share the member satisfaction results. Obviously, members are really happy with the program because, again, they're able to save a lot of money and get treatment much more quickly. I'm going to go ahead and move on. I told you I was going to go quickly here, so good thing I'm a northerner because we can talk really fast. The next product I want to talk about is pre-admission and post-discharge counseling. And this is actually a product that we recently developed for a large customer that came on board and was just concerned about members actually having access to the information that they need to be prepared for maybe upcoming surgeries that they're going to have, or to be prepared when they're discharged from the hospital. And again, I think the first statement on here, again, is really pretty compelling, that preventable admissions account for about $25 billion in wasteful healthcare spending. So what happens, a member goes in and they have a surgery done. If they're not prepared, they might not have the assistance that they're going to need when they get home. A lot of times you want to make sure you've got a family member or a friend there to take care of you. If you don't have that type of support, there's a pretty decent chance you could end up back in the hospital again because you're just not getting the help and the care that you're going to need to do well. So because of that, we've developed a pre-admission as well as a post-discharge counseling program where we have case managers call a member a couple days prior to their surgery and really educate them on what to expect and to be prepared for when they go back home. So some of the things that we're working with these members on is how to prevent infections. What do they do with their medications? If they're on a blood thinner, typically the doctor's going to want you to not take the blood thinner the day of your surgery. Members don't always realize that. They didn't get the message. They show up for their surgery and they took the blood thinner and now they can't have the surgery. So now there's a rescheduling fee. So we're able to help with some of those sorts of gaps and again make sure that they're preparing for the post-surgery needs that they're going to have. Same thing on the post-discharge counseling. If any of you have been in the hospital before, you know what it's like when you're being discharged. They're handing you a handful of scripts or maybe a bag full of medications. They're rattling off a bunch of instructions about how to change the bandage that you have or make sure you make this follow-up appointment, etc. It's really overwhelming, and you're not feeling well anyway, and they're trying to tell you all this information. That's another reason why people end up back in the hospital. So we have nurses that will go ahead and call that member and help them to make sure that they're having a follow-up care that they need, what signs to watch out for in terms of possible infections that they could receive, etc. Moving on to advanced radiology. I think it was Tom actually that mentioned yesterday he's seen MRIs that are as expensive as like $6,000. Imaging costs have doubled since 2000. They're actually the fastest growing expense of all medical categories. They now represent between 12 and 20% of total healthcare expenditures, and the average growth rate is between 7 and 12%. So it's definitely something that we really need to address. So what we've done is we've actually partnered with a company called US Imaging and built an advanced radiology scheduling service where we work with the employer to make sure that in their plan, first of all, that they need to have a pre-cert for any outpatient radiology. So make sure that we're getting a phone call if a member is going to have an MRI, a CAT scan, a PET scan. And we then look at that procedure to make sure, is it really medically necessary? Or does the doctor just want you to have your annual MRI as part of your annual physical? So we make sure that it's really medically appropriate for you to have that to start with. And then, if so, then we'll go ahead and get you hooked up with US Imaging, which is a large network of radiology facilities to really work with you and help you to get an appointment made at an in-network provider that's going to have the best possible rate for you within your area. The savings are huge. 36% of savings is the average savings with this product. 9 out of 10 members are able to actually tap into one of these providers, so they're very readily available, and they're very satisfied with the product. They really kind of hold their hand through that whole process, give them a reminder, explain to them what to expect with the test, and so forth. So just really a great product. And you can see on the chart or on the table the types of savings that we're finding for each of the different types of radiology services, with an average of 44%. So huge savings, high member satisfaction, and it's really something I think that everyone needs to be focused on getting their arms around, because it's not going to go away. So moving on then to pre-service negotiation, that I think Paul alluded to this earlier, and it's kind of common sense too probably, but it's not typically how things happen. And that's that the best time to negotiate is when you still have that leverage and before the members actually incurred that service. So for years we've had a negotiation and bill auditing department, but a lot of clients tend to tap into that again after they get that bill in and they're ready to send it out the door and they want us to take a last look at it and see if we can bring down the price. And we still do that, but what we're really focused on right now is trying to get involved much sooner. So again, the call comes in as a pre-cert. We're looking to see, is it really medically necessary for that member to have that care? We're trying to steer them into an in-network facility. It's just not always possible. So sometimes you still have claims that are going to be out of network, but also on some of the really expensive implantable devices, durable medical equipment, pharmaceutical cases, maybe a member that's going through an oncology case. In those types of situations, whether it's in-network or out-of-network, we can still get involved and really try to reduce that cost. And so we're looking for those cases right up front through the pre-certification process, and then we can do transfer right into our bill auditing. Also, Cypress was talking yesterday. They're very good at this. They have their own internal department that does a lot of negotiations as well. And so part of the integration that we're able to set up with them is to work very closely. So we get in a pre-cert, and a member is going to start a chemotherapy regimen. We're able to work closely with Cypress and be able to get them involved and just really partner together more and more to be able to work on that price up front. So, and I wanted to share a couple examples. It's just incredible, I think, when you look at these. These are real live examples. The first one is for an oncology case where the member is taking a couple different medications. The total bill to start with was about $75,000. Blue Cross, has huge favor there, and we have a $4,000 discount. But by getting involved with our negotiators and auditors, they're able to get 200% of ASP and bring that overall price down to $34,000. So we started out at 75, we ended up at 34, just by taking a little bit of extra time on that case and doing some research and negotiating. And then the second one is on a prosthetic. Again, that one started out at $20,000 in terms of the initial billed amount. First of all, we got involved and we corrected the claim. They say 8 out of 10 hospital bills have billing errors, and you would be amazed what you find out there. So once we kind of got the junk out of the bill, if you will, we brought the price down to $13,000. We then got involved and got some additional negotiations in there for a prompt pay discount, got a 15% discount, and brought the overall allowable amount down to $11,000. So just by picking up a phone, just by asking some questions, you're able to get that price down. I want to spend just a few minutes on oncology case management. One thing you may or may not know about us, but we have quite a few specialty areas within American Health Holding. So we have units of nurses that only work on oncology cases, only focus on transplant. Neonate's another unit for us. But oncology has just more and more become really, I think, an area of expertise for us and an area that we're really focused on. In fact, we do more oncology case management than any other type of case management. And so we have some really good nurses that average about 10 years of experience with oncology that are really working these cases. And they're really trying to strike a balance between spending their time helping that member and helping their family member to navigate that really complex, kind of scary system, if you will, when they're going through some type of cancer diagnosis. But then also being very involved in, okay, what kind of treatment is that doctor recommending for that member. And what's the cost look like? How can we impact that cost? And how can we make sure that at the end of the day, when this makes its way onto a stop-loss carrier, it's actually going to be covered? Because you always have to obviously be really mindful of that. And so our case managers, as I mentioned, really try to strike that balance. And so with the member themselves, they work on really educating them on their condition, talking about different treatment options that might be available to them. And depending on the type of cancer, there might be quite a few different options that that member could take. And so educating them on those options that they do have. Really assisting them in navigating, the kind of the healthcare system, if you will. And then just some of that emotional support, and really trying to tap into any other benefits that they might have, whether it be an EAP or community services and so forth. From a client standpoint, though, I think probably the biggest thing is we're able to find out about these cases early on. And again, I'm standing on my soapbox for just a minute, but one of the things I would say, please take away from this, if you don't already have outpatient chemotherapy on your pre-cert list, I would really recommend that you add it. There's so many people that have cancer that maybe don't go inpatient, or don't go inpatient, for quite a long period of time. And so it might not necessarily show up on the radar screen right away. So make sure that you have a pre-cert process in place to pre-cert chemotherapy so that we can find out about it very, very early on, and therefore be able to impact the cost and the overall treatment plan for that member. So we've really worked really hard to try and have kind of a bulletproof system, if you will, and just really have all the checks and balances in place to make sure that, again, that treatment plan that member is undergoing is going to be covered by the plan and by the stop loss, should it hit the stop loss deductible, which most likely it probably will. So some of the things that our nurses are doing, and again, I think by having nurses that only focus on oncology, they're very, very good at kind of knowing and understanding kind of the latest and greatest. So determining the FDA status of each drug in that patient's diagnosis, making sure that cocktail of drugs is going to be covered, making sure that sequencing of drugs is going to be covered. Also working closely with the TPA to look at the plan language and understanding the definitions of medically necessary and investigational unproven and so forth. So that's all a really, really important part of the whole deal. So last product that I wanted to touch on before we wrap up here today is our disease management program. We've been doing disease management for, I don't know, about 10 years now. And we've gone through lots of revelations with the program as well. But I think we've really have a really nice program put together with a lot of flexibility built into it as well for our clients to be able to kind of build a program that's really going to work well for them. There's really 8 primary conditions in the program that are all listed out here, probably the usual suspects, if you will. But clients have the ability to say, we want you to coach everybody with one of these conditions, or we just want you to coach, the highest 10%, perhaps the 10% highest risk members, or we want something in between, or we just want to focus on these certain conditions, or we want to pay you a different way for the program. Or in some cases, we'll have hospital clients that say, we have nurses and we want to be able to do the coaching ourselves for our members and provide coaching on site, but we don't have the infrastructure. We don't have the predictive modeling. We don't have a system to perform that in, et cetera. And so we're really able to work with our clients and really customize a program that's going to work for their specific needs. They can buy the parts they want to purchase from us and do the rest themselves. So lots and lots of flexibility there. Something else that we've just recently rolled out is a partnership with IHS, where we're able to offer, and probably a lot of you are familiar with IHS in terms of their biometric testing, but it can also, not only is it helpful for a wellness program, but it can also really be sort of a feeder for disease management as well, because there's a large percentage of people walking around today that have diabetes and they don't know it, that have high blood pressure and they don't know it. So it's a really good way to have people become aware of a chronic condition that they may have, hopefully get them diagnosed earlier on in their disease stage, and then again funnel that over to disease management. And that's very helpful from the identification standpoint, as well as to be able to just provide that biometric information to our nurses so that they can use that during the coaching process. We also just recently rolled out a new predictive modeling tool that we're pretty excited about. Traditional predictive modeling tools normally take anywhere from about 4 to 6 weeks. Each month they'll get in claims data and pharmacy data, run it through their algorithms and so forth, and by the time you get the results, it's about 4 to 6 weeks out. So again, you're missing opportunities to impact that case a lot sooner in that process. With our new predictive modeling tool, it takes about 10 business days so we can find cases a lot more quickly. It's giving us a lot more information in terms of the gaps in care. So that's information, again, that's helpful to our nurse to know, when's the last time the patient had their hemoglobin A1C tested, if they're diabetic, if they had their annual testing done, those sorts of things. So it's really helpful to us, just gives us a lot of good data on that patient. And again, we find the cases a lot sooner than maybe we did in the past. We also have the ability to do pre-sale reporting. So for any of you maybe that don't have a program in place right now, or you have clients that might be interested, we're able to, for any Cypress clients, we're already hooked up with them. We do disease management for quite a number of their clients. We're able to, at no charge, take in the claims data and run it through our algorithms and let you know how impactful we might be able to be in having a disease management program for your particular group. So looking at the prevalence, looking at kind of where you're spending your claim dollars, and share that with you and help you determine whether that's a program that might be effective for you. So that's available for anyone that, that might be interested in that. The last thing I wanted to touch on is our cost savings methodology. There's lots and lots of conversations, and the Disease Management Association has been working for years to kind of roll out the final return on investment methodology. And I think it's a lot more challenging than anyone really thought it would be. But rather than waiting and for them to come around and kind of figure out the way, if you will, to measure, we've partnered with a company called Solucia Consulting to come up with a methodology that we can utilize to show the cost savings with our program. And it really is based on looking at the managed population versus that non-managed population, and doing a comparison over that same time period. And so what we found with that study is that on average, the cost savings per member per month is about $244. And I want to show you an example of a 7,000 life hospital group that we've worked with and what the results are for them. And you probably all know that's about the toughest group that you can recruit into a disease management program. They're in the industry. They're the last ones to really take care of themselves. It's very stressful. They tend to pick up a lot of bad health habits. So they're always a challenge to engage in the program and therefore to have good savings on. But I think we've been able to do it. In this example, as you can see the results on the bottom, we were able to maintain the costs for members with asthma as well as CHF. But for the other conditions, diabetes and heart disease and so forth, we were able to save approximately $331 per managed member per month, or a total of about $3,300 per member per year. So we're pretty happy and pretty excited about those results, and we'd be happy to share more details with you about what that methodology is that we utilized. So again, just kind of a quick little summary in terms of the products that we talked about today. But again, this is kind of the philosophy of our company, is to continuously look at how can we improve core products that we have, such as our utilization management and case management programs. Also, what else can we offer you that we think can integrate well with the medical management program to be able to save you or save your clients money, as well as make the members healthier. Okay, well again, we certainly appreciate your time, and I want to thank Cypress as well for inviting us to be here today. And if you have other questions too about oncology, we'd be happy to chat about it, and my policy is going to be around all day. So thank you so much, everybody. Appreciate it. Have a good trip home.